Hello, I'm Leonard Brown, and in today's video I want to talk to you about something deeply important, something that most people never question, yet it may be silently affecting the most vital muscle in your body, your heart. This is not about rare diseases or experimental drugs. This is about medications millions of older adults take every single day, often believing they are as harmless as candy, pills taken for pain, for stomach protection, or for a simple cold. Medications that live quietly in bathroom cabinets, rarely questioned, rarely discussed. Before we go any further, I want to ask you to stay with me until the end of this video. And when we finish, I want you to leave a comment below writing exactly this: I protect my heart with knowledge. That simple action matters more than you think. My goal today is not to scare you, it's to give you clarity. Because the real danger is not disease itself, but misinformation and blind trust in things we assume are safe just because they're common. Over the years, I've seen what happens when the heart is pushed beyond its limits. Not suddenly, not dramatically, but slowly, quietly, over time. And very often medications play a bigger role than people realise. As we age, our heart changes. It becomes less forgiving. It works harder against stiffer blood vessels. It responds more strongly to fluid shifts, blood pressure changes, and chemical signals in the body. What a younger heart can tolerate, an older heart may not. And this is where the story begins. Let's start with something almost everyone has used at some point. Pain relievers. Medications like ibuprofen, naproxen, or diclofenac are household names. They're often the first choice for back pain, joint pain, arthritis, or headaches. They work, there's no doubt about that. But when used frequently, especially in people over 60 or those with heart conditions, they can quietly overload the cardiovascular system. These drugs interfere with substances that protect kidney function and blood vessels. As a result, the body retains salt and water. Imagine your heart as a pump. Now imagine suddenly increasing the amount of fluid it has to move through the system every minute of the day. The pressure rises, the workload increases. For an aging heart, this can be the tipping point. At the same time, these medications can narrow blood vessels and raise blood pressure, even in people who never had hypertension before. And if someone is already taking medication to control their blood pressure, these painkillers can cancel out that protection without any warning signs. This is how heart failure can appear seemingly out of nowhere. Now, as we move from pain relief to protection, we arrive at another medication many people trust blindly: stomach protectors. Proton pump inhibitors, such as omeprazole or pantoprazole, are often prescribed for reflux or to protect the stomach from other drugs. Millions of people take them daily for years. What many don't realise is that stomach acid is not just a nuisance. It plays a crucial role in nutrient absorption. When acid is suppressed long-term, magnesium levels can drop silently. Magnesium is essential for heart rhythm stability. When it's low, the heart's electrical system becomes unstable. Irregular heartbeats can appear, sometimes without symptoms, sometimes with dangerous consequences. There's also growing concern, supported by observational studies, that long-term use of these medications may be linked to increased cardiovascular risk. The exact mechanism is still debated, but reduced nitric oxide availability and vascular stiffness may play a role. And what makes this especially concerning is that these medications were originally designed for short-term use, weeks, not years. Yet many people take them indefinitely without reassessment. From here, we move naturally to something even more deceptive because it's used for such a simple reason: the common cold. Oral decongestants containing pseudoephedrine or phenylephrine may clear a stuffy nose, but they do so by constricting blood vessels. And they don't limit that effect to the nose, they constrict vessels throughout the entire body. This increases blood pressure and forces the heart to pump against greater resistance. At the same time, these drugs stimulate the heart, making it beat faster and sometimes irregularly. For someone with high blood pressure or underlying heart disease, this combination can be dangerous. What worries me most is that these medications are available without prescription. People take them without reading labels, without connecting a cold remedy to heart risk. As we transition from physical symptoms to emotional health, we reach a more delicate topic, but an essential one: mental health treatment. Some older antidepressants, particularly tricyclic antidepressants, are still used today, sometimes for depression, sometimes for nerve pain. While they can be effective, they can also lower blood pressure suddenly when standing, speed up the heart, and interfere with the heart's electrical conduction system. This can lead to dizziness, falls, and dangerous arrhythmias. In older adults, the risk is significantly higher. Today, safer alternatives often exist, but these medications remain in use without proper monitoring. And finally, we arrive at the most controversial topic of all: calcium supplements. For decades, people were told to take calcium to protect their bones, and dietary calcium from food remains important and generally safe. The concern arises with high-dose calcium supplements. When calcium is consumed through supplements, blood levels spike rapidly. The body cannot always direct that calcium to the bones. Some evidence suggests it may deposit in blood vessel walls, contributing to arterial stiffness and plaque formation. Studies on this topic are mixed, but enough concern exists that calcium supplementation should never be automatic. It must be individualized, weighing bone health against cardiovascular risk. What ties all of these medications together is not that they are inherently bad, it's that they are often used without re-evaluation, without context, without considering how the body changes with age. My message today is not stop your medications. That would be dangerous. My message is awareness. Knowledge turns patients into partners. Before we close, I want to ask you to do something important. If any part of this video surprised you, leave a comment below and write, "I protect my heart with knowledge." Share this video with someone you love, a parent, a grandparent, a friend. One conversation can change a life. And remember, it is always a pleasure to accompany you on this journey toward health and comprehensive well-being. Thank you for trusting me with your time, and I'll see you in the next video.